first thing is to try to get that disc pulled back inside and recentered so that those chemicals stop stimulating the nerve, so that it stops feeling pain. And then we use what we call a class 4 laser to heal that mesh network around the outside of the disc. It's a fibrous mesh network, and it actually helps to heal that class 4 laser, because a disc does not have a lot of blood flow. So it doesn't heal very easily. In fact, what we found is that if you're doing decompression therapy, which is the main therapy we use for herniated discs, when you're doing that without a class 4 laser, it does not heal very well. They have a high relapse probability. And so being able to use a class 4 laser to heal the disc while you bring that jelly back to the center and recenter that, while you work on their biomechanics, while you get their posture corrected, while you get their muscles strengthened so they can hold that alignment, that's when we see the most success, and that's what we do here.